My name's Lauren, and I'm going to be doing my final head to toe assessment. First, I'm going to scan the room. Right, so before I go into my patient's room, I'm going to check the chart to make sure I have the right patient. I'm doing the right procedure. I'm going to provide for privacy, wash my hands, and then I'm going to identify my patient with their name and date of birth. Can you tell me your name and date of birth?
Yeah, Michael Shooty, 6190.
Are you in any pain today?
No,
And what brings you in?
just a physical checkup.
Okay. So first I'm going to start out with doing my cranial nerves to get those out of the way. The first one is olfactory, which is smell. So, do you have any issues with smelling?
No,
No? Okay. So he said no. I could also do a smell test. So, for example, I could put some coffee under his nose and have him close his eyes and tell me what it is. Number two is optic. Do you have any issues with vision?
no.
And if he did say yes, I would use the Snellen chart to establish his level of vision. Next is going to be 3, 4, and 6 that I'm going to do, and I'm going to do my 6 cardinal gazes with that. I'm just going to have you follow my pen with your eyes without moving your head. Okay, so his eyes followed the pen correctly without any twitching or sudden movement. So cranial nerves 3, 4, and 6 are intact. Next is 5, which is the trigeminal. So with that, I would palpate the temporomandibular joint to feel for any clicks. If you could just open and shut your jaw for me. Okay, and I didn't feel any clicks. Was there any tenderness with that?
No.
Okay, so cranial nerve number 5 is intact. Next would be number 7, which is facial. So I'm going to have you raise your eyebrows, puff your cheeks, smile, and frown. Okay, so cranial nerve number 7 is intact. Next would be cranial nerve number 8, which is acoustic. And with that, I would do a whisper test. So just repeat what I tell you.
Some.
Okay, so he passed the whisper test, so cranial nerve number 8 is intact. Next I'm going to do 9 and 10. So I'm going to have him open his mouth and say ah.
Ah.
Okay, so the uvula and the soft palate both raise midline, and his gag reflex is intact. So number 9 and 10 would be intact. Next I'm going to do cranial nerve number 11. So I'm going to have you try to raise your shoulders against my resistance. Okay? And then rotate your head against my hand. Other side. Okay? And then for cranial nerve number 12, I'm going to have you stick your tongue out. Okay? And it's midline, it didn't deviate to one side or the other. And can you say light, tight, dynamite?
Light, tight dynamite.
Okay, so cranial nerve number 12 is intact. Next, I'm going to start with my head assessment. Just visually looking at his head, it's symmetric. And then I'm going to palpate. And I didn't feel any masses. I didn't notice any lesions, any lacerations. His hair is evenly distributed. There doesn't appear to be any hair loss or any fading. Next, I'm going to start with my facial assessment of the skin. His skin appears to have pink undertones. It's warm to the touch. It's dry. It's not moist. The hair on his face is evenly distributed. His facial features are symmetric with his face. And then next I'm going to start with eyes. So visually inspecting the eyes, I'm going to pull the eyelids down. The conjunctiva is pink and moist. His sclera is white. There's no opacities. His eyebrows and eyelashes, the hair is evenly distributed. There doesn't appear to be any drooping. So Then next I'm gonna check his pupil size. And it appears to be about a 4 for each eye. And then I'm gonna test for light constriction. Okay, so his left eye constricted appropriately with light. And the right eye did as well. And when I shined it in each eye, I noticed that the opposite eye constricted consensually with the light. And next I'm going to check for accommodation. So I'm just going to have you look at something far away and then follow my pen. Okay, and his pupils accommodated appropriately with that. They are round and reactive to light. And then I already did my 6 cardinal gazes. So next I'm going to move on to the ears. And first I would push on the tragus, pull on the pinna, and then push on the mastoid process. Did you feel any tenderness when I did that?
No.
Okay. And then I'm going to look in his ears. Okay, I don't notice any redness, any lesions, any masses, any foreign objects, just some serenum. If I had an otoscope, I would look to see that the tympanic membrane was a pearly gray. So now I'm going to look in the other ear. Same with that ear, there's no redness, no drainage, no foreign objects. And next I'm going to palpate the temporal arteries. And they're both a +2 equal and bilaterally. Next I'm going to palpate the sinuses, the frontal sinuses, and then the maxillary sinuses. Did you have any tenderness or pain when I did that?
No.
Okay. And then next I'm going to do my nose exam. So I'm going to look up each one of the nares. Okay. His nares both appear to be patent. There's no septum deviation. There's no redness, no drainage. Everything appears to be normal with that. And then next I'm going to do my mouth assessment. So I'm just going to have you open your mouth and put your tongue down. Alright, so his hard palate appears to be intact, his teeth are intact, the uvula and the soft palate both rose midline. There doesn't appear to be any sores, the gums aren't red, there's no bleeding, the teeth are intact, the tonsils would be a +1. His lips are moist and pink, there's no sores on his lips or any abrasions or lacerations. Next I'm going to do my neck assessment, and I'm going to feel for the thyroid gland. So I would go behind him, and then I would shift the trachea slightly to the right, and then can you swallow? And I felt it rise. Okay. And then next I'm going to do my lymph nodes. So right here is going to be preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, and then the deep cervical chain I'm going to go behind him because that's easier for me to do. We want to get in there like under the muscle to feel that one. Okay. And then the posterior cervical, and the supraclavicular. Okay. And then next I'm going to do my neuro exam. So overall the patient's attitude is pleasant, calm, his actions are intentional, his speech is clear and appropriate, he's dressed appropriately for the weather, his affect is positive, he doesn't have any sudden movements, and then can you tell me where you're at right now?
Flint, Michigan.
Can you tell me who the president is?
Donald Trump.
And can you tell me the year and the month?
2018 April.
Okay, so my patient is alert and oriented ×3. For the Glasgow Coma Scale, his eyes are spontaneous. He's responding appropriately there. He's responding to verbal commands for the motor portion. And for the verbal portion, he's alert and oriented ×3, so he would get a 15 out of 15 for that. And then I'm going to move on to my musculoskeletal exam. So for that, I'm going to start out with his gait. If I could just have you walk over there and then walk back. Okay, his gait appears to be steady. And then I'm going to do the Romberg test next. If I could just have you stand up and then close your eyes. Okay, you can sit back down. Alright, so he didn't have any like unsteady movements there, so he would have passed that. Next I'm going to do the Babinski reflex test. If you could just give me your foot. Okay, so his toes didn't curl, so that test would be negative. And then I'm going to test for some strength. If you could just grab my fingers as tight as you can. Okay, and then push on my hands. Okay, pull me towards you. Okay, and then I'm going to do the same with his feet. You could just put both your feet out like in front of you. Okay. And then I'm going to push down your feet, just try to resist as much as you can. Okay, and then push up on my hands. Okay, so his strength was equal and bilateral for both of his legs and his hands. And then if you could just take your finger and touch it to your nose. Okay, so his coordination is accurate. And next I'm going to start with my cardiac and lung assessment. And if I could just have you take your sweatshirt off. Okay. So just looking at like the skin on his arms, everything appears to be normal. It has nice warm pink undertones. The hair is evenly distributed. Just some tattoos. I don't notice any abrasions, lacerations, any sores, or anything like that. If I could just have you take your shirt off for this part of the exam. Okay, so then just visually inspecting his chest, I don't notice him in any respiratory distress. Hair is evenly distributed. There's just some small macules, no cuts, abrasions, lacerations, or anything like that. So now I'm going to start with listening to my heart sounds. So the first one would be the aortic, which is going to be the second intercostal space on the right sternal border. Okay, and the second one would be pulmonic, and that's going to be the second intercostal space in the left sternal border. Okay, And then Herb's Point, which is gonna be the third intercostal space, left sternal border. Right, and then the tricuspid, which is gonna be the fifth intercostal space, left sternal border. And then the mitral valve is gonna be the fifth intercostal space, midclavicular line. Okay, so the heart sounds are normal. I didn't hear any gallops or murmurs or any extra sounds. Next, I'm gonna palpate the carotid arteries, one at a time. And they're both a +2 equal and bilateral. You can leave that off. And then next I'm gonna listen for any bruits. I'm gonna listen to 3 spots on your neck. I just need you to hold your breath, okay? Go ahead. Okay, you can release. Then I'm gonna do the other side. Hold your breath. Okay, there were no bruits noted. And then I'm going to do my pulses and my extremities. I'm going to start with the radial pulses. I'm going to do both of them at the same time to compare. And they're both a +2 equal and bilaterally. And then you can rest your arms. And I'm going to do the brachial pulse. They're both equal, +2. Next, I'm going to do the dorsalis pedis artery on the top of the foot. You can just lift your foot out. Okay. And that one's a +2. It's a +2 as well. And then I'm going to do the posterior tibial artery, which is going to be on the inside of the ankle. That is also a +2. I'm going to do that on the right side as well. Okay, and then while I'm down here, I'm just gonna feel around his ankles, and I don't notice any edema, no swelling. And then I'm gonna do cap refill on his toes. And it was brisk, less than 3 seconds. And then I'm going to do the other foot. On this ankle, I don't notice any edema, there's no swelling. I'm going to do the cap refill here as well. Okay, and it was brisk, less than 3 seconds. And then I'm going to do the popliteal artery, which is going to be under the knee. Just have you kind of extend your leg a little bit. Okay, that's about a +1. It's kind of hard to feel. Okay, and that's about a +1 as well. Next, I'm just gonna assess his wrists. There's no swelling or edema there on either one of those. And then I'm gonna do my cap refill on his hands as well. Okay, the right hand was brisk, less than 3 seconds. Same with the left hand, it was brisk, less than 3 seconds. And as I was assessing his wrists, his arms, his ankles, I didn't notice any swelling or redness in the joints. His range of motion seems to be okay. I'm gonna test that on his arms and then his legs. If I could just have you like take your arm out to the side and go like that. Okay, and then do a leg raise with each of your legs. Okay, so his range of motion appears to be good. Next, I'm gonna have you lay down here for a minute. Lay the other way.
Which way? This way?
Yeah. Okay, so now I'm gonna check for jugular vein distension. And he is laying flat. I do not notice any jugular vein distension, but I'm gonna have you sit up at a 45-degree angle. And I do not see it there either. And then I'm gonna have him lay back down, and I'm gonna check for an apical pulse, which is gonna be right here along the fifth intercostal space and the clavicular line. Okay, I can feel it slightly, but there's no heaves or lifts with that. You can go ahead and sit back up. Here. So then I'm going to start with my respiratory exam. First I'm going to do tactile fremitus. Every time you feel my hand, say 99.
99. 99. 99. 99.
Okay, so the sound was resonant, there wasn't any dullness in his voice. And then next I'm gonna palpate the chest wall for any like masses or anything like lumps. And there doesn't appear to be any. Next I'm gonna do symmetric expansion. You can just take a deep breath in and out. Okay, so his lungs expanded equally and bilaterally. I didn't palpate any crepitus. And next I'm going to auscultate the breath sounds. Just kind of take a deep breath every time you hear my stethoscope. Okay, so his breath sounds in both lobes were clear. I didn't hear any wheezing or crackling. Next, I am going to percuss. So I'm gonna go like between in the intercostal spaces, so I'm not hitting bone because it would be a dull sound. Okay, and the sound was resonant, and then I'm gonna have you turn around. Okay, so just observing the skin back here, there's just some small macules. The skin is warm to touch. It's dry, it's got pink undertones, it's appropriate for ethnicity. There doesn't appear to be any lacerations, or any scarring, bruising, just a tattoo. And next I am going to do symmetric expansion. So I'm going to place my hands back here, and if you could just take a deep breath in for me. Okay. And both sides rose equally and bilaterally. As I'm palpating, I'm not feeling any crepitus. I didn't feel any crepitus when he was breathing in. And then I'm going to auscultate my breath sounds. Okay, so both of his lungs sounded clear, no wheezing, no crackling. The sounds were obvious, there was no diminishing of any sounds. Next, I'm going to percuss in the intercostal spaces. So we want to avoid the scapula. Right down here would be about T7 at the end of the scapula. Okay, so everything appeared to be normal with the respiratory exam. Next, I'm going to move on to my abdomen exam. And I'm just going to have you lay down right here. Okay, so just doing my inspection of the abdomen, it appears rounded, it doesn't appear distended or bloated, anything like that. Just a quick skin assessment. The skin has pink undertones, it's warm to the touch, hair is evenly distributed, it's appropriate for ethnicity. Just some small macules. So after my inspection, I would start auscultating in all 4 quadrants. I'm going to start with the right lower, go to right upper, then left lower. Okay, so the bowel sounds were active. Next, I'm going to percuss the abdomen, starting in the right lower quadrant. Okay, and then I'm going to assess for any bruits in the arteries. First, I'm going to start with the aorta. Next, I'm going to do the renal arteries. Then I'm going to do the iliac arteries. Okay, and I didn't notice any bruits. And also, when I'm inspecting the abdomen, I noticed that the umbilicus is midline. There are no heaves or lifts or anything with breathing. Next, I'm going to palpate. Before I palpate, I'm going to ask, are you in any pain
No.
in your abdomen at all?
No, no.
Okay. And if he did state that he was in pain, I would palpate that quadrant last. But first, I'm going to start with the right lower, and I'm going to do a light touch first. Do you feel any pain or tenderness?
No.
Okay. Next, I'm going to do a deep palpation. Did you have any pain or tenderness there?
No, no.
Okay. You can go ahead and sit up. Just have you sit back up here. Okay. So next I'm going to start with my subjective data. I'm going to go from head to toe with that. So starting with the head, I'm just going to ask a couple questions. Have you ever had a head injury?
No.
Do you have any dizziness?
No.
Any fainting?
No.
Any seizures?
No.
Okay. And then for the eyes, do you have any vision problems?
No.
Do you wear glasses or contacts?
No.
And when's the last time you were at the eye doctor?
Probably a couple months ago.
Okay. Do you see any, is your vision ever like cloudy?
No.
Okay. Do you get frequent headaches?
No.
Okay. Do you get frequent earaches?
No.
Do you have any pain in your ears or any discharge?
No, none.
Any blood?
No.
Okay. Do you get frequent upper respiratory infections?
No.
Do you have any allergies?
No.
Do you have any drainage from your nose or any irritation?
Nope.
Okay. Are you on any current medications?
Nope.
Okay. Do you have a family history of stroke or epilepsy?
No.
Okay. What about any history of cancer?
No, not that I'm aware of. No.
Okay. Do you smoke?
No.
Do you drink alcohol?
No. No.
Okay. Do you use drugs?
No.
Okay. And then I'm gonna move on to cardiac. Do you have any chest pain while breathing?
No.
Do you ever have any shortness of breath?
No.
How many pillows do you sleep with that night?
Two.
Okay. Do you wake up frequently during the night to use the bathroom?
No.
Okay. Have you ever had a past history of like a heart attack or anything like that?
No.
Any family history of cardiovascular disease?
No, nothing like that.
Okay. And then respiratory, I'm gonna go on to that. Have you ever had like bronchitis or tuberculosis?
No.
Okay. When was your last TB test?
I think last year.
Okay. Do you get like frequent colds or do you
No.
do you have a cough right now?
No.
Okay. Next I'm gonna move on to abdominal. When was your last bowel movement?
Earlier today.
Okay. Do you have any nausea or vomiting?
No.
Have you ever noticed any blood or mucus in your stool?
Nope.
Okay. And how would you say your diet is?
Healthy.
Okay. Do you ever have like any abdominal cramping?
No.
Okay. Next, I'm gonna move on to musculoskeletal. Do you ever have any like pain or swelling in your joints?
Nope.
Do you have any limitations to like your range of motion or any daily activities?
No.
Okay. Have you noticed any hair loss anywhere?
Nope.
Okay. Have you noticed any skin itching? Any excessive bruising? Any rashes?
No, not like that.
Okay. And then with your eyes, do you have like irritation with your eyes, like any redness or drainage?
No.
Okay. Do you have any reproductive concerns?
No.
Okay. Do you have any current concerns right now about your health?
No, none.
Okay. So that finishes my exam. Before I would leave, I would make sure my patient is not in any pain. I would assess his current condition, make sure he's comfortable before I leave, and then after I leave, I would go document what I had just done.